In the regen world right now, you have this entire population of individuals that's 40 to 90 years old, and they've lived through the most toxicity in the history of the human species. Day in, day out exposures to these environmental issues that we're dealing with. And so I've talked to groups, presentations for a decade and a half at this point in time, and I have yet to find a collection of providers that are as committed to wellness, not just pain relief, wellness. With biogenetics, what I seek to do is to help practitioners find those things and then develop a strategy to help the patient get rid of them and allow that person to have a quality of life. So one of the big things that you see in modern medicine right now with all of the chronic conditions is everybody's looking for a single cause, and like the rock in the shoe, so to speak. And you're not going to find the single cause. If it was a single cause, the chronic disease wouldn't exist, because you would just press that button and the patient would get better and everything would be awesome. But what we're finding is that with these multifactorial conditions, whether it be organic disease or orthopedic issues, etc., these patients don't have a resource for themselves to be able to assess what are all of the underlying drivers. What are the underlying causes? What we've been able to do is to help providers in a position where they know what to do and why. That's the key, why. So when we look at wellness, the biggest thing that I want providers to latch onto, if I can say it that way, is having an evidence-based practice, okay? Now, how we participate in that through the diagnostic strategy is basically being able to assess the patient's situation, whatever diagnostic criteria is required there. Sometimes it's just blood testings. Really what we're trying to do is we're trying to be able to assimilate that information into a story. What's the story? What has been going on? And if it's something that's different from what their goals are, how do we take that story and redirect it through these diagnostics? What we can see in the medical literature is that if you have appropriate diagnostic strategy, it allows you to come up with a plan. If you don't have appropriate diagnostic strategy, the patient might have 14 problems, right? And if they're like dominoes and you line up 14 dominoes in a row, if you push the 10th domino, they still have 9 problems, right? But if you line up the diagnostic strategy the right way, and you can see what's the first domino, you can press that first domino and the rest of them come down as well. And that's really the difference between where medicine has been and where it is going at this point. So when we look at patient relationships, doctor-patient strategy, one of the big things that I like to go into every patient visit with is treating the patient like they're my own mother. Asking yourself, would I do this if this were my mom sitting across from me? Would I do this? Is this the right decision? Right? At the end of the day, if you have the ability to go into every patient visit with that innocence of, I am going to do everything in my power to help this person, nothing more and certainly nothing less. One of the things that I get so excited about working with my injection training and being able to be at a Regen Summit, something like this, is the ability to connect with other providers that have expertise in different areas of healthcare. You're not going to meet doctors that care more about patient outcomes than people that you're going to find at my injection training. It just doesn't exist. First and foremost, Karen is a servant's heart. And that's something that should be in healthcare every day, but you don't see that every day. You do with her. I love it. So anything that Karen wants me to participate in, I'm happy to help her, because I know that her heart's in the right spot and she is out there crushing chronic disease with people. So it's been awesome. And so with biogenetics, what we really seek to do is to bring clarity in the diagnostic space and be able to craft a comprehensive diagnosis for these patients so that they can have a comprehensive treatment plan. For instance, one of the places that we do this at Biogenetics is every Friday we have a meetup with hundreds of providers. It's free on Fridays at 11 a.m. Eastern. And we get together and we do case reviews. We walk through the medical literature. We bounce ideas off of each other. And I host it most of the time myself. There are a few other providers that like to step in every now and then. but it's really a place where we can take the next generation of healthcare and start building into them things that maybe took me 15 years to learn. Maybe it only takes you 5 days. There's two ways that healthcare gets changed. One is through patient demands, right? And the other one is going to be through provider vision. And if you have a vision for what you want your practice to look like, what you want your style of healthcare to look like, that goes a long way, because life has a funny way of connecting people into that vision in places like the Regen Summit. And, once a year, having MIT put something on like this, once a year, being able to connect with these doctors, as the times that I've been participating, has been absolutely fruitful, right? Being able to connect with these doctors and to ask them, how did you figure that out? How did you think about that? Right? And then how do you go deliver that to the patient? It's a gold mine when it comes to being able to rub shoulders with people that are doing things that you want to do. And everybody's got a vision, right, for what they want. And if they don't, you got to start there.